Welcome to Global Dispatches, a podcast for the international affairs, foreign policy, and global development community, and world news aficionados of all stripes. I'm your host, Mark Leon Goldberg, editor of UN Dispatch. Enjoy the show. The COVID-19 pandemic is just the latest iteration of what my guest today, Charles Kenny, calls the unending war between humanity and infectious disease. His new book, The Plague Cycle, documents and describes how the course of human history has been shaped by infectious disease. The book takes us from the dawn of humanity hundreds of thousands of years ago up to early 2021 to explain how we as a species and as a society have been challenged by microbes. The book is one of the best global health books I've read in a while, and it offers some really important historic grounding for understanding the current pandemic. So it was great to have Charles Kenny back on the show. About 5 years ago, we had a long conversation about his life and career and the interesting moments in global development which his life and career intersected with. He is a well-known optimist, and in that conversation, he discusses and describes the roots of his optimistic outlook on the course of human history. That was a great conversation. It's available now exclusively to premium subscribers of the show, along with dozens of other conversations and interviews with thought leaders, newsmakers, and other people who have led interesting lives and careers in foreign policy and international affairs. To become a premium subscriber, please visit patreon.com/Global Dispatches or follow the links in the show notes of this episode, or just go to globaldispatchespodcast.com. For now, here is my conversation with Charles Kenny, Senior Fellow at the Center for Global Development and author of the new book, The Plague Cycle, The Unending War Between Humanity and Infectious Disease. As I'm preparing for this interview, I just find myself overwhelmed because of the scope of history that you cover in your book from the dawn of humanity to early 2021. Let's maybe just start at the beginning as you do. And I learned from your book that we are related to the same individual, mitochondrial Eve. Just explain that concept of mitochondrial Eve and also describe what infectious diseases do we know might have impacted her life and the life of those around her.
Mitochondrial Eve is the first woman who we can say is sort of related to all people who are alive today. And scientists sort of look at our genetic material and they figure out about how fast it mutates, and they go back and they say, well, look, if you look at the range of genetic material out there in humans today, how many generations back do you have to go before you get to a single person, and it's a single woman, it's mitochondrial Eve. So she's not a real person, if you will. She's but the ancestor to us all, at least in sort of some genetic sense of the term. And she lived before civilization. She will have lived in Africa, probably in the Rift Valley, and she'll have been part of a hunter-gatherer community, and she won't have been exposed to pretty much any diseases that just infect humans because there just weren't enough humans around. So she will have been infected by diseases that also affect animals. There are a whole bunch of them, including yellow fever. These are zoonoses, and of course we all know about zoonoses today because COVID-19, sadly, is another one. It came to us, probably from bats.
So 100,000 years ago, infectious disease did not impact humanity too much. And it was when humans started living together in civilization and in cities that infectious disease started to really take off. Can you just describe that process?
Sure. So diseases like measles are incredibly infectious. But once you've had measles, you don't get it again. And so if you're a measles virus, you need lots of people to infect. Otherwise, you run out of new victims, and the victims either die or they get better. And if they get better, they're immune to reinfection. And so the measles virus would just die out. So it needs lots and lots of people. So there's always new people to infect, in particular, new children. So, People aren't born with immunity to measles. So as long as enough new kids are being born, measles viruses always have somewhere new to go. But that takes a whole lot of people. The estimate is about 500,000 people in order to keep the measles virus going in a community. And in pre-civilization, I mean, at the beginning, there weren't that many humans on the planet, but in pre-civilization, there certainly weren't that many humans around and connected and sort of densely living together in order to keep a disease like measles around. So it didn't exist. It evolved after humans started farming and then started living in cities, started living densely together, and started trading with each other. That's what gave these new kinds of infectious diseases the mass of people they needed to survive. And so many of humanity's greatest killers only emerged after agriculture and civilization, and that includes diseases like smallpox and diseases like measles.
Can you give an example of how early in civilization that an infectious disease altered the course of human history?
The first sort of pandemic we know about in early civilization is the plague of Athens. Some of your listeners might know Hippocrates is sort of traditionally thought of as the father of Western medicine, and he was around in Athens at the time of this plague that struck the city as it was fighting Sparta. Despite his best attempts, and actually some of the things he suggested were reasonably sensible, like burying the dead pretty quickly, Athens lost a lot of people to an infection that's quite well described by the historian Herodotus. And the disease kind of weakened Athens, killed off the leader of the city, and is one of the factors behind Sparta winning that war. Sadly, Hippocrates, despite sort of being best known for the Hippocratic Oath, this idea that doctors should first do no harm, wasn't actually that generous a spirit. When the Persians came along and said, "Hey, look, we've got this plague too," he sort of took one look and said, "I'm not helping the enemy," and turned his back on them. This is the early version of vaccine nationalism, if you will, refusing to help others, despite the fact it's probably in your best interest to do so. So ever since the first pandemics we've known about, we've been having these rather foolish responses to infection. But after that, you just get a litany of plagues sort of through history. The perhaps one of the most sort of famous is the plague of Justinian, which was pretty much helped put the death knell to the Roman Empire. Killed off a large proportion of the population of the Roman Empire and allowed Islam to spread through North Africa, and the Goths to spread throughout Western Europe. And then, of course, we have the Black Death, and on it goes. So throughout history, we've seen these massive pandemics that kill, millions, hundreds of millions of people emerging, and they are just a sort of a side effect of having a dense, globally connected planet.
And it was those global connections in like the 14th, 15th, 16th century that caused just mass death, on this hemisphere, as well as you demonstrate in your book. Again, like I think underscoring just how profound a world historic force infectious disease is.
Absolutely. The Americas, well, and Australasia, not least, would look just completely different without the effects of infection. I mean, it's just ridiculous to think that, a few hundred Spanish troops could overrun the scale of civilizations that they discovered in the New World without the fact that infection had already fatally weakened these civilizations. So, we would have a New World that looks much more like parts of the Asia and the Africas if it weren't for the impact of disease in the New World, which, along with immense violence, let's be clear, but it was the major factor in the fact that in the majority of the countries in the Americas, the Native American population is a small minority. Nearly all of the people in those countries are descended not from the original population, but from migrants who came later. And that's because disease wiped out nearly all of the people who were already there.
And we're like sprinting through history here, but it's I think it's important, I think, to underscore some of the key themes of your book. So let's fast forward to the Industrial Revolution. How did the plague cycle, impact the course of history and impact life on planet Earth during the Industrial Revolution? What did that next iteration of the plague cycle look like?
So if you imagine the cycle starting with the rise of cities and agriculture, and that setting off this sort of firestorm of new diseases, and peaking, if you will, at the time of the sort of first globalization. So Columbus reaching America, Vasco da Gama going around Africa. The Industrial Revolution is when you start to see in parts of the world a decline, but only as we get into the Industrial Revolution, because frankly, some of the lowest life expectancies we've seen worldwide were in some of the early cities, early periods of the Industrial Revolution in the United Kingdom. So people pack into cities to work in factories in cities that don't have sewer systems, or at least don't have nearly enough in the way of sewage systems. No rules on housing density or any of that kind of stuff. No rules on food and cleanliness and so on. They're death traps, and we see life expectancies drop into the 20s.
In the United Kingdom, in the United Kingdom,
the richest country in the world at the time.
Which was that. I mean, that to me was one of the most fascinating. There's a lot of like great and fascinating tidbits in your book, but that to me was just, I think, illustrative of just how profound an impact infectious disease has on life expectancy, even in the wealthiest country at the time.
Yes, and frankly, Britain does not come out looking terribly good in this book for a number of reasons. One is that early in the Industrial Revolution, the response in the UK is pretty much, oh, well, it's that the poor are being lazy and they're not eating properly. And it takes a while for the sort of the liberal end of the UK opinion to move towards the idea that, oh, well, maybe they're poor because they're sick. And then they do actually start putting in place, amongst other things, sewage systems on the basis of completely terrible medicine. They think that the sickness is caused by miasma, by bad smells. But luckily, the way you deal with miasma is through better sewage systems that take the bad smells away. So, even the wrong medical theory led to the better outcome. Meanwhile, in the British Empire, cholera is being spread by the British Army, particularly in India. And the response, the British leadership in India being good Malthusians to a man, is, oh, well, there are too many Indians. This is probably a good thing for the quality of life of people in India. So, all in all, the 19th century Britain is, really shows itself up for what bad theories can do in terms of destroying quality of life worldwide.
And when was it that life expectancy in cities began to outpace that of life expectancy in rural areas?
The gap starts to drop in the middle of the 19th century in London, and I talk about this quite at length in the book. The first step of improving the sewage system is they connect all of the existing sewage pits and so on to a sewage system that dumps all of the sewage into the River Thames, with a theory that it'll then be taken downstream on the flow. They made the mistake of having some of those sewers empty into the river above the water intakes for a large part of London. Not surprisingly, the result is a massive cholera outbreak. And luckily for the people suffering that cholera outbreak, the other thing that the system does is pretty much make the Thames solid with excrement. The smell is terrible. And again, this is at a time when many of the leading lights of medical thought think that what causes disease is bad smell. well, the Thames full of excrement smells really bad, and the Houses of Parliament in the UK is right on the Thames. And so this bad smell is wafting through the windows into the House of Lords and the House of Commons. And, the British elite is going, ah! And so they realize that something has to be done. And they hire this engineer, Bazalgette, to build intercepting sewers, huge, great sewage lines that take all of the sewage out of the center of London, down the Thames, and way below the water intakes for the East End of London. And pretty much, that ends cholera in London, and it's the start of a sort of sewage revolution, if you will, that a bunch of other cities quite quickly thereafter in the UK, in Europe, and the United States start putting in place new water and sewage systems. But it goes, far beyond that. You start seeing the term "the Great Unwashed" appears sort of in the later half of the 19th century. And it's a new idea because everybody used to be unwashed, and suddenly being clean becomes a fashionable thing to be. And cities start opening swimming pools. They're not actually swimming pools; they're baths, and they're called baths in the United States. The idea isn't that you get exercise by swimming. The idea is you go to these public baths to clean yourself. And they start opening in cities, and you start getting regulations on noxious trades, and you start getting regulations on housing density, and a huge amount of government intervention of one kind or another. And that sort of sets off a bit of a revolution in terms of health and life expectancy in cities. And so, by the early 20th century, you're seeing cities in the UK and United States being pretty much as healthy as rural areas.
And this begins what you describe as a flattening of the plague cycle, which is also accompanied by technological innovations like vaccines and other public health measures, which, just as plagues have impacted the course of human history, so has the ability of humanity to confront some of these plagues and infectious diseases.
The vaccine story is fascinating, and sort of people traditionally think of it as starting with Jenner, a British doctor, and in many ways it does. But there's a wonderful sort of story before that, which really starts in China and then spreads to India and through the Middle East, which is of inoculation, which nowadays we kind of use interchangeably with vaccination, but it is a slightly it's sort of one kind, if you will, of vaccination, and slightly different. And what inoculation was to begin with was people taking scabs from the poxes you get from smallpox, grinding them up and sniffing them in their nose, or burning them a little bit and then sniffing them, or sometimes taking some of the pus out of the pox. Sorry for being disgusting, but taking some of the pus out of the pox and scratching it into people's arms. And this technique is risky. Sometimes it leads to people getting smallpox, and smallpox is a deadly disease. And so some people died, but your chance of dying was much lower. Your chance of getting a sort of mild case of smallpox rather than a full-blown case that could kill you is much higher. And so as smallpox spreads, so does this technique, and it reaches Turkey, where the wife of a British diplomat, Lady Mary Wortley Montagu, sees it being done, and she's had smallpox reasonably recently. She was a beauty, but as a result of smallpox, she lost her eyebrows, and so was touchy on the subject, if you will. She wanted to avoid her son getting it, so got him inoculated, and it worked. And she brought it back to the UK and was mates with the Queen in the UK at the time, and gets the Queen to do it, and that of course makes it trendy. So it spreads through the UK. And the way that Jenner tests his vaccine, which is a similar approach, except it takes the pus from a cowpox, a related disease from smallpox that usually affects cows, and uses that to infect humans, which actually gives them immunity against smallpox. But the way he tested whether his approach had worked was he uses this inoculation process on the kid that he's just vaccinated. And so sort of the first vaccine relied on testing on this earlier inoculation approach. And vaccination, this original vaccination, spreads quite rapidly and worldwide in the 19th century. The Spanish king sets up a kind of global effort to spread it around the Spanish Empire. The Swedes by 1812 are saying everybody must get vaccinated. But sadly, we didn't see any new vaccinations for another 80 years or so, partially because Jenner didn't really understand what he'd done. He had this sort of idea that people who got cowpox didn't seem to get smallpox, but he didn't understand why. And we have to wait for the French scientist Pasteur to figure out why this might have worked, and then sort of apply a similar technique to a bunch of other diseases, including rabies and anthrax, and sort of explain the underlying science behind the idea so other people can go off and create the range of vaccines we have today. And those vaccines spread worldwide. One of the problems with sewage and sanitation is it's quite expensive. It involves, millions of bricks in the case of the London sewage system, for example. And skinflint empires weren't willing to lay that kind of money out in colonies. So the sanitation revolution really didn't affect much of the planet until way into the 20th century. Vaccinations are cheap as a rule and reasonably easy to spread worldwide. And so a lot of the progress we've seen against especially childhood infection in the developing world hasn't been underpinned by sanitation. Sanitation's played an important role and should play a bigger role going forward. But it's been underpinned instead by these cheaper techniques like vaccination, like bed nets, like oral rehydration therapy, which is basically giving kids with diarrhea water and sugar and salt. It's a cheap and incredibly effective way to stop kids dying from stomach bugs.
And maybe just to underscore the profound effect of vaccines on, the course of human civilization. I mean, you have some statistics in your book just demonstrating how many more children now live to the age of 5 years old compared to, say, in 1950.
Yeah, if we had the death rates of the 1950s, actually, if we had the death rates of the 1970s, there would be sort of one child under the age of 5 dying every second worldwide. We still have one child dying every 5 seconds worldwide, and most of those deaths are easily preventable, and so that's shocking. But still, it's 1/5 of the rate we would have had only a few decades ago. We have made incredible progress. And another way of looking at it is to view it from the point of view of the parents. So the average mother and father worldwide, the average mother worldwide is having a lot fewer kids than they used to. But also those kids are much more likely to survive. And when you put those two things together, it means we've gone from a world where the average parent would expect to bury at least one child before the age of 5, possibly 2 or 3, to a time when that's a rarity worldwide. That is, a rare tragedy worldwide, rather than the expected outcome of being a parent. And, frankly, if I wanted one measure of how the world is a better place than it used to be, it would be that.
You published this book in the midst of a pandemic, the COVID-19 pandemic. And your book, to me, offers almost like a potential heuristic with which to understand the long-term historical implications of this pandemic that we are currently all living through. So I'm curious to learn from you, what do you see as the potential historic impact of this pandemic? Like, if you were writing your book, 100 years from now or 200 years from now, looking back, what do you think the long-term impacts of this pandemic might be on, the course of human history?
One of the things that looking at some of previous pandemics tells you about COVID-19 is that it is a tragic event that could have been a lot less tragic, but also is a lot less tragic than some previous pandemics, if you will. We are looking at millions of deaths, many of which, perhaps most of which, were avoidable. But, this sort of pales in comparison to the Black Death or the Plague of Justinian, or what happened in the years after Columbus reached the Americas. And in some ways, I think that points to how large the long-term effect is likely to be. In that, I mentioned in the book, the Black Death had an impact in the long term. By wiping out about a third of the workforce, it did actually slightly improve the wages and quality of life of those people left behind, slightly in a way that we'd hardly notice, because we'd consider it going from absolute poverty to absolute poverty. But still, an improvement. But that took wiping out a third of the population, and a lot of life just almost went on exactly as before. The English and the French were fighting the 100 Years' War at the time, and they stopped for sort of 6 months, but then they're back at it. In some ways, it's remarkable how small the sort of immediate impact of the Black Death was on historical processes. And so I know some people at the moment are talking about, we're all going to move out of cities because they're dangerous, and we've discovered that Zoom works. I would be doubtful, to be honest. I think probably we aren't going to see a huge effect. And I mean, through most of history, COVID probably wouldn't even have been noticed as a new disease. So many people every year were dying from infections with overlapping symptoms with COVID-19. I'm not sure anybody would kind of noticed, frankly, the difference. So that's in a way a sign of our progress against disease, and maybe because we've made so much progress against disease, this one will have a bigger effect than you might think, just on the basis of its sort of absolute death count. But I still think probably in 200 years this will not be a chapter of history books. It will be closer to a footnote.
Is there anything else you'd want to mention or bring into this conversation?
I think it's one of the things that the history taught me, at least over the last 100 years, is sort of back to the tragic element of COVID-19. That 100 years ago we were dealing with the so-called Spanish flu, although probably not Spanish, the 1918 flu pandemic. And we were having discussions about the role of closing schools and masking and social distancing and so on the spread of that disease. Before that, during a pneumonic plague outbreak in the late 19th century in Manchuria, Chinese doctors were saying, let's have restrictions on travel and masking and social distancing. And it kind of sort of helped work to end that pandemic. And yet here we are again, having apparently, forgotten a lot of those lessons. And, frankly, you don't need to look 100 years back. A number of states in the United States, including Texas and Florida and so on, have completely opened up again and say no need for masking. It does seem incredible how unwilling we are to learn the lessons of what works, and we've put all of our faith in these new vaccines, and they're fantastic, and they are rolling out very fast. And although, at the moment it is globally incredibly inequitable, the rollout of these vaccines, still it will probably be by far the most rapid global rollout of a vaccine ever in history. So that's all great. But, with the best will in the world, you need to test these vaccines. There's going to be a gap between vaccine invention and vaccine rollout around the world. We still need these other approaches like masking and distancing and testing and tracking and so on. And we just seem unwilling to put in the the effort, the resources, and the sort of restrictions on behavior in order to make sure that people don't die as a result in the meantime. And so, while I'm sort of basically optimistic about the course of pandemics going forward and the course of infection going forward, I believe we'll get back on a cycle of fewer and fewer people dying from these infections going forward. You have to have some doubts because we seem so good at forgetting the lessons of the past in a way that could, lead to another pandemic that's even worse with even more deaths.
Well, Charles, the book was absolutely fascinating. You are a great narrator to take readers through, the course of human history. And I just highly recommend it. I'll post a link to it in the show notes. Thank you.
Thank you.
All right. Thank you so much to Charles. That was a great conversation. The book is super. I really highly recommend it. He is just a great narrator of human history. It's a lively read. It's accessible. It's not wonky. It's interesting. I could not more highly recommend this book. And I will post a link to it in the show notes of this episode. While you're there, please also click on the link to become a premium subscriber, where you will unlock my conversation with Charles Kenny about his life and career, along with dozens of other conversations with key newsmakers in international affairs. Thank you. See you next time. Bye.